Dr. Roni Zeiger is no stranger to medicine, but when he caught pneumonia 5 years ago, he experienced being a patient for the first time. He realized there was a disconnect between the hospitals and the patients. Hospitals today are physician-centered and don't allow for much patient participation in their own care. Dr. Zeiger knows that it is hard for physicians to keep up with changing patient information, so why not involve those who know their experiences the best, the patients themselves? Fascinated by this idea, Dr. Zeiger founded Smart Patients, a company using patient knowledge to improve healthcare. What is the mission behind Smart Patients?
So Smart Patients is a new company that I co-founded with a wonderful man named Gilles Friedman just a few months ago. The basic premise is that patients are probably the most underutilized resource in medicine. A whole bunch of them are finding each other online, teaching and learning with each other, and I think there's a lot of things that the rest of the healthcare system can learn from patients, and hopefully we can build some tools to help people do that.
And what inspired you to make this company?
Well, you know, I've had an unusual path, I think. I've worked in medicine. I still practice a little bit in urgent care. I have some technology background, and I got a chance to learn in the last couple of years about some of the amazing conversations that happen in online patient communities, and was surprised that both as a physician and as a technologist that I was pretty much unaware of especially the scientific caliber of conversations that happen among patients who don't have previous medical training but have had to learn the science behind their illness or the illness of their loved ones. And I realized that this is really happening off the grid from the perspective of the rest of the healthcare system. And I don't think it needs to be that separate. And so hopefully we can provide contexts and environments and tools for more patients to learn from each other. And in addition, make it so that those patients can more easily collaborate with medical providers and other parts of the industry so that we can all learn more and more quickly.
And coming from the physician's perspective, what role do you think doctors have to play in this new era where patients are more empowered and are taking more ownership over their diseases?
Well, you know, the way I think about it sometimes is that as a medical system, we often focus on the one day, say the one day per quarter, that the patient is with us in clinic or admitted in the hospital or similar. And most of healthcare happens on the other 89 days of the quarter. And you know, I think we're slowly understanding this and getting better at engaging with people in a broader way, with care teams, with an understanding that the healthcare system revolves around the patient and her environment, and not just around the doctor and the nurse and the physical therapist. So collaboration is the word that I really focused on in my talk here at Medicine X, and I think that the role of the doctor and every other aspect of the healthcare system is to understand how each of us can be a better collaborator with the patient and his or her environment to achieve the goals that we're trying to achieve.
And what advice do you have for medical students, you know, the future doctors, who are getting their training and their education now while in the midst of all of this happening?
Well, so medicine and healthcare is hugely complex, lots of different things for lots of different people to do. So I'm not sure if this is what you meant, but I don't think the answer is everyone should go and focus necessarily on the kinds of problems that I think are important. I think everyone should really figure out what gets them excited and follow their passion, and that will be the way that they can contribute best, I hope.
Mm-hmm. What do you think medical students can do at this point in their training to better understand and help patients with their knowledge of their own diseases?
Well, you know, I think that medical students today are probably going to be very different from medical students, you know, 15 years ago, 20 years ago when I was a medical student. And that's because the world has changed a ton around us. You know, there was no Facebook and Twitter, for example, when I trained. And so I think just understanding where our patients are coming from, being comfortable with the many different uses of technology, of the cultural change that makes it more normal to go and ask questions, both of your care team and of your friends and of other patients that you meet in the waiting room and of other people that you might find online. And normalizing that and acknowledging that it's absolutely not perfect. It's very easy to find bad information in different places, but that it's also easy to find good information, and that's part of the culture that we should all be participating in and making work better.
And I understand that you also had your own patient experience that showed you the other side of being in the hospital, aside from being a physician. Can you tell me a little more about that experience?
Sure. Well, I've had a handful. The one that I spoke about yesterday wasn't actually a particularly severe one. It was a useful context for a couple of points that I think are worth keeping in mind. I was admitted actually here at Stanford several years back, and I had a pneumonia, and not too big of a deal, but there was an interesting experience when. For me, it was interesting that when a significant change in my care plan was made, just a switch of antibiotic to broader spectrum, bigger gun, as it were, and I asked why. And it was very interesting to me as a well-trained physician, lots of physician friends on the other side of a phone line that accessible to me anytime. It was actually pretty difficult to have a good, informed conversation, and it was pretty clear that it wasn't expected for a patient to say, "Oh, well, why?" And I felt quite isolated. You know, there was sort of the metaphor of, well, there was the literal aspect of being in a gown and not having any other clothes accessible, my butt kind of hanging out in the wind, and then the metaphor of being quite ill-equipped. At this time there was no Wi-Fi for patients, so I didn't have access to the tools that I was used to having access to. And it was clear that in the broader sense, the medical team in the hospital wasn't prepared or frankly that interested in collaborating with me in my care. It was a very asymmetrical relationship in which I was meant to be the recipient of the care, and I wanted to participate more. That showed me that obviously there are many other ways, not only from a how to treat people right perspective, because that wasn't the issue for me, but how to provide better care in a way that I will understand, I as a patient would understand better, would more likely comply with, for example, my outpatient, my discharge meds, etc. And totally trivial example, but a good reminder.
And as a physician, you were dealing with patients in the hospital every day prior to that experience. Had you ever thought of that perspective before?
Well, sure. You know, I think of myself as a sensitive person, and I'm always trying to observe how things are going. But of course, when you experience something from a different perspective, it gives you insight that you otherwise might not have had access to.